So I'm Pat Downing, as it says here on the slide, Senior Director at Microsoft for Hospital Information Systems. Now, you might go, heck, didn't know we had hospital information systems at Microsoft. I'm going to do a little PowerPoint just to show you some of that, but actually, really I want to talk a lot more about medicine. Let me go through a little presentation, just show you a little bit of what we're doing with medicine right now at Microsoft and tell you actually what Microsoft is doing in healthcare. This is actually a timeline that shows Microsoft and healthcare. And from 1995 to 2004, it's probably a familiar timeline to you, where we were always working behind the scenes, making these BizTalk HL7 accelerators and lots of tools. But as you can see, in 2005 through 2007, there was actually two important things that just got highlighted there. Was the Healthcare Solutions Group was formed, and really there was a cornerstone piece of technology called Azixi at that point, and now it's called Amalga UIS. For Unified Intelligence System, was acquired from the MedStar Group. In the rest of the world, they don't want best-of-breed systems. They really do shop for a single integrated solution. They want multilingual systems. In Thailand, for example, it is not the year 2009. It is the year 2563, I believe. They run on the Buddhist calendar, okay? In Islamic countries, they run in the 1400s because they run on the Hijra calendar system. When you print patient education materials or pharmacy labels, you print it in the patient's native language. And in a single hospital, that native language might be Chinese for some patients, Thai for other patients, Arabic for some, and English for others. So commercially available HISs on this planet just weren't there to satisfy that need. So that was the impetus behind starting Global Care Solutions, making this product, and Microsoft wanted to get into the global healthcare space. I avoid the word international healthcare space because I think that is a little bit strange that we think in America we're the lead and everybody else is international. Well, in Thailand, America would be considered the foreign country. So it's really a global market we were going after. And so because of all the research we'd done on how the different markets work, it was quite a good fit. And we were always compelled to use Microsoft technologies when we built it. And even before that acquisition, key cornerstone technology was medicine. Now this is just another bit more about Microsoft. Is we actually have in our Healthcare Solutions Group enterprise solutions and consumer solutions. So enterprise is things that run in hospitals. That's this Amalga UIS, which you would install in a very complex healthcare system in North America, for example, where you have New York Presbyterian Hospital or Hopkins or some of our customers, or the Wisconsin Health Information Exchange, where they have hundreds of computer systems. And they can't see the forest because of the trees and all that sort of stuff. So you put Amalga UIS in the middle of this, and it consolidates all that data and frees it and allows doctors to take a look at data from anywhere. Nurses, pharmacists, lab guys, everybody can see data through Amalga UIS. Now, but with HIS, we're selling that, by the way, so don't be scared, out in the emerging markets, okay? Because that's where we think we can make a huge impact. So I don't want to make everybody frightened that we're going to come in here as Microsoft and knock over, as we say, your rice bowl here in North America. We are firmly thinking about Asia, Middle East, etc., because they are largely building hospitals out there. We've spent a huge amount of investment on that multilingual capabilities, so that's where our markets are for our HIS, our RIS PACS, and these other products. Health Vault and everything else, that's internet-based, electronic medical records, personal health records, etc. All of these have sprinklings of medicine throughout them. The difference in US and the rest of the world healthcare is the outpatients, they go to the hospitals. Have you ever seen a 554-bed hospital with 1.2 million outpatient visits a year? The doctors practice at the hospitals, the outpatient doctors. One of the reasons they do this is because in America, if I'm here in the Washington, D.C. area and I want to get an MRI of my knee, I can go to any one of probably 100 magnets that are around the Beltway at the end of some shopping mall somewhere and get an MRI of my knee. But in the rest of the world, it doesn't spend money like that. So all the medical equipment is focused at the facilities. So then the doctors practice very near the facilities because they don't want to buy their own magnet or their own panoramic dental system, etc. So all the big iron assets are at the hospital, so the doctors naturally congregate, and you get these giant patient volumes. This also drives how software is made. We have to have a combined outpatient-inpatient system. One database, one data model, medicine terms for inpatient and outpatient. Our solution runs in one rack. I'm talking lab, pharmacy, radiology, electronic medical records, CPOE, accounting, billing, human resource, payroll, time clock. Basically, you name it, we kind of make it, and it goes into one box and it gets stored in a big SAN, etc. So that's the kind of configuration that the rest of the world demands because the budgets are not as big. If you have a 554-bed hospital that's as glamorous as Bumrungrad Hospital, they'll have an entire annual IT budget of $1.5 to $2 million a year. Tops. That's it. That's their budget. When they go shopping for a system, it's a $3 million budget. I kind of live on planet reality that I can't get all doctors to do anything I want all in one day. I can get a little bit, and I work on them over time, but we give them medicine forms, we give them speech recognition, we give them word processors, and to be honest, I give them a scrap of paper with barcodes written all over it so I can get them all participating in the electronic medical record. It's a very key strategy at Microsoft. I want to be one of those few vendors that's going to be able to push fast enough to be able to demo at HIMSS next year, and we're going to have forms and CliniTalk available to our doctors, because you really got to give the doctors choice. This is from the Ministry of Defense of Malaysia. And one of the things that I wanted to emphasize to the Ministry of Defense was that the thing is so easy to use that they just faxed up a couple of forms before they visited us one day, and we said, well, we'll just build you some medicine forms very quickly. So it's so easy for someone to adopt this technology. This is Chinese medicine. Chinese medicine. For this stuff to work in the rest of the planet, it actually has to work in the native language of the clinician. Now, this is review of systems done in Chinese as well. Sooner or later, we have to do things like Arabic support. You're seeing here, there's Arabic right there. You really have to think in the international market, multilingual capabilities. And that's what a patient printout for abdominal pain would look like in Arabic. You see how everything flips right to left? This is really my last screen here, and I just show you one slide I pulled out of my usual marketing deck, which is pharmacy. We do a fantastic medication management system, which is attached to our CPOE system, which is attached to our clinical documentation system. The reason I used attached 3 or 4 times, because all of this stuff works in one database. The reason why this is important from a medicine point of view is that we want to have a single problem list in our system. If I had Joe making the pharmacy system and Fred making the CPOE system and Janie making the EMR system, and the doctor wasn't collecting the problem list in a common vocabulary across them, sure, you can get a CPOE and an EMR to do a common vocabulary, but the pharmacy system, that'll have a different vocabulary for problem lists. And it's even a JCO requirement. Every time you order something, you have to say what problem you're trying to solve with that order. So wouldn't it be really nice in this world if everything worked together that seamlessly? But with medicine and that common terminology base, I have a broad enough vocabulary to do everything inpatient and outpatient all from one vendor. So it makes me really happy, saves me a lot of time. And the clinical efficiencies that occur are just extraordinary. Because then afterwards, all the data mining capabilities, because we're just using a single common vocabulary, is absolutely extraordinary.